The third and fourth parts of the research protocol are about the methods. So you've got your background, you've got your objectives, how are you going to achieve it? Then you then need to talk about the design and how you're going to conduct the study. So the methods section has multiple parts, and it should be detailed enough so that somebody else can come along and carry out the same study. Think of it as a recipe, a step-by-step guide of how you're going to address your research objectives, because that's how it will be assessed. So when somebody assesses a research protocol, they want to know whether the design will meet the objectives. So you need to know what design you're going to use, what your population will be, how you will sample, how you will recruit your sample, what your measures will be, and how you'll define and operationalize your measures. Obviously, with regard to the design, you now know, because you've had many sessions on different designs, there are many different types of designs for both quantitative and qualitative. So it may be that it's prospective, retrospective, it may be an observational study, it might be a randomized clinical trial, it might be a survey or an interview study, it may be focus groups if it's qualitative, or it might be a systematic review. Here are some examples. When you're writing a protocol, these are the kinds of wording that you would use. So you would just very succinctly give a sentence on what the design of your study is. So a prospective randomized controlled trial of implants versus no implants, so that's the design. Or it may be a systematic review with meta-analysis of the clinical, demographic and psychosocial predictors of oral health quality of life. So you've got one sentence on the actual study design. In terms of the population, you need to say how you're going to select them, how they're defined, the appropriateness for the study objectives, why that particular population, how accessible they are, how you'll follow them up, how representative they are, and the criteria for inclusion and exclusion. And this is the same whether it be a primary data collection study or a systematic review. So in a systematic review, the population is actually your articles. So you'll still have how you define them, how you're operationalizing them, and how you're including or excluding those articles. So you'll need to talk about sampling. So what's the sampling? So the frame, so is it a district, for example, a household, a people, or is it published articles if it's a systematic review? The method of sampling, what type of method you're going to use, and if necessary, the randomization procedures. Your sample size, you need to talk about how you justify it. So this comes back to what I was talking about in the unit of statistics. Often we don't see people report predetermined sample sizes, but you must get into the habit of talking about why you've chosen a particular sample size, and that again goes for both quantitative and qualitative research. Do you need to do a power calculation? Is there any previous data that allows you to do a power calculation? Do you have a comparison or control group? Do you need one? And what's the feasibility of recruiting that number of patients? So if, for example, you are looking at something that's not that common, say people's experiences of orthodontic surgery, and you want to get 100 people for your project, is that really feasible in the amount of people coming through the hospital, for example? So you need to think about the kinds of people you're recruiting and whether you'll be able to recruit them in the time available. You then need to move on to how they will be recruited. So is it just going to be a convenient sample, for example, of patients, or a sample of nurses in the hospital, or general population sample? Are you going to recruit from waiting rooms or from the general population by standing on the street or putting adverts in particular magazines? Are you going to put adverts in clinics? If you're doing a systematic review, what databases are you going to use? Which electronic sources, so PubMed, Medline, etc. And then in relation to the design, you need to then specify very clearly how and when and where your observations and variables are going to be measured. And you need to describe the instruments used. So often when we read protocols, people might mention the kinds of variables that they're going to include, but they don't include the instruments that are going to measure them. You need to include those within your protocols. So if you're using questionnaires, self-report questionnaires, for example, oral health quality of life, that has to be attached to the protocol in the appendix. If you're doing an interview, you have to include the interview schedule in the protocol. If you're doing a laboratory test as a clinical examination, then you have to refer to the literature, so the published study that explains that test. And similarly with clinical examinations, how you're going to conduct those, what sort of instruments you need, and who's going to conduct those. This is just an example of the definition of variables that we sometimes use when we're doing different types of work with oral health quality of life. So, for example, you see on the left there the variables that we might include, so age, family size, different types of nutritional status, patient satisfaction, etc., etc. Then we talk about how we operationalize each of those variables, and then we talk about the scale of measurement. So, for example, age, we're interested in age at the last birthday, and we'd ask them to just report their age as a whole number or in months. So we have a very clearly worked out plan of all of our measures, how we're going to measure them, and then we'd include that within the appendix. Next step in the methods is how you're going to conduct your study. Who's going to collect it? Do they know what the purpose of the study is? So are they blinded or not? And when are they going to collect it? It's really important that you carry out pilot studies or pre-testing of key aspects of the study. No study should ever proceed without doing a pilot study. So you need to describe how you're going to test, for example, whether the sampling procedures are feasible, whether your data collection methods are feasible, and whether your questionnaire is valid. So often, for example, in questionnaire type research, we might give our questionnaire to 10 or so people and check that they understand it, that it's relevant to them, etc., etc. It's really important to do this before you begin, because once you've collected your data for a study, you can't go back again and redo it. And also with relation to conduct, you need to talk about what you're going to do when you've got your data. So how are you going to handle it? Is it going to be inputted into, for example, a spreadsheet, Excel or SPSS? How is it going to be coded? Who's going to code it? Is it going to be checked, for example? What we tend to do is when we're entering things into spreadsheets, we get a random percentage of that checked by another person who doesn't know anything about research to check that everything's okay and there are no mistakes. Data analysis. So I've talked to you previously about the types of statistical tests that we might use for our data, and obviously you now need to, if you're doing a quantitative study, talk about the statistical tests that you might use and how you're going to analyse your data. But also with regard to qualitative work, you also need to talk about how you're going to analyse that and the methods that you're going to use. So, for example, you need to talk about your objectives again and how you're going to meet each of those objectives. So you may have 1, 2, 3, 4, whatever number of objectives, and you need to talk about what you're going to do to meet each of those. Why is this really important? Often when people are conducting research, particularly if they're at the beginning of their research career, they don't have an idea of why it's so important to think about their analysis before they begin. One of the things that I've seen many times over the years is that people who don't think about their analysis before they begin, they collect data that's inappropriate, for example. It's in the wrong format and they can't do anything with it when they've finished, which means that the study has been wasted. And so if you have a plan in advance, then you know what you're going to do with that data and what data you've got. So it's really important that you have that analysis worked out, because not only will it collect data that will not be used, but it will prevent the failure to collect important information. It also allows you to come up with better estimates of sample size for the analysis of subgroups. If you've thought before about what you're trying to do and what you're analysing, what your objectives are, then you can get good sample sizes for any additional information or tests that you're going to do on particular subgroups. It also prevents what I've talked about previously, where things are just thrown in, all the variables are thrown into analysis, you don't know what you're doing with it, and so you just try to analyse everything. So if you have an analysis plan that's specific to your objectives, then you don't get that kind of everything analysis that we see so commonly in dental research.